For over 30 years, Humana has been committed to the care of our members. Through our expertise and partnerships, we provide whole-person health care that adapts and evolves with you, no matter where you are on your health journey. Choosing the right Medicare plan can help you get the care you need to feel your best. That's easier to do when you understand your plan choices. Humana can help. There are certain times when you can enroll, disenroll, or change your Medicare plan. The annual enrollment period is October 15th through December 7th. During the rest of the year, if certain special conditions apply, you may qualify for a special enrollment period. Ask your licensed sales agent if you qualify. Now let's look at the Centers for Medicare and Medicaid Services Medicare prescription drug coverage. That's Medicare Part D. It's designed to help you save money on your prescription drugs. You can enroll even if you haven't had a prescription drug plan or PDP in the past. Medicare PDPs are available only from private insurance companies approved by Medicare. Timing matters. Those who don't enroll in a Part D plan when first eligible might pay a penalty for late enrollment. The longer you wait after you become eligible, the higher the penalty will be. So how do you get prescription coverage? You have two options. Option 1, join a standalone prescription drug plan like a Humana PDP, which covers only prescription drugs. Option 2, join a Medicare Advantage plan with prescription drug coverage. If you are already enrolled in a Medicare Advantage plan and then you also enroll in a standalone PDP, in most cases you'll automatically be disenrolled from the Medicare Advantage plan. So if you have a Medicare Advantage plan, talk to your agent before enrolling in a prescription drug plan. Humana offers 3 standalone Medicare Part D prescription plans to help you balance your health needs and budget. They are the Humana Walmart RX Plan PDP, the Humana Enhanced PDP, and the Humana Preferred RX Plan PDP. Talk to your Humana sales agent about in-network pharmacies for each plan, along with specific benefits, premiums, and co-payments for plans in your area. Here's how we structured the plans. Drugs are separated into tiers. Tier 1 is preferred generic drugs. Tier 2 is generic drugs. Tier 3 is preferred brand drugs. Tier 4 is non-preferred drugs. Tier 5 is specialty drugs. Generally, the higher the tier, the more expensive the drug. There are a few other things to keep in mind. Be sure to review the formulary, that's the prescription drug plan's drug list, with your agent. You can find Humana's drug list at humana.com. Make sure the plan you choose covers the drugs you use before you enroll. Even if your medicines are listed, Humana may require you to try certain drugs first to treat your health problems before we'll cover more expensive drugs. This is called step therapy. Besides brand name drugs, a Humana prescription drug plan may offer generic alternatives, which can mean even greater savings. There's also a pharmacy network with preferred cost sharing at select stores. You pay a lower cost using network pharmacies. In some areas, the availability of preferred cost share pharmacies is limited. If you live in one of these limited service areas, you may still enroll in a Humana PDP, but you may pay more if you don't fill your prescriptions at a pharmacy with preferred cost sharing. To take advantage of lower copays, make sure you can travel to these pharmacies before enrolling. Ask your agent which pharmacies offer preferred cost sharing. Manufacturers must agree with CMS's terms and conditions to contract with Medicare, so not all brand name drugs may be covered. In the coverage gap, or donut hole, you pay part of the drug cost before additional Medicare coverage kicks in. In 2019, you'll pay no more than 37% of the cost of many generics and no more than 25% of the cost of many brand name drugs during the coverage gap. Except for employer groups with waivers, people with Medicare who receive a low-income subsidy or have an employer-sponsored retiree drug plan aren't eligible for this discount. Okay, we've discussed when to sign up, what your Medicare Part D options are, and the specifics of prescription drug coverage. What's next? Your agent will go over 2 important documents. One is the Summary of Benefits, which covers many of the features of a Humana PDP. The other is the plan's drug list. If you choose to sign up for a PDP, decide if you'd like to receive your plan documents by mail or online. If you decide to go digital, we'll email you a link to Humana.com where you can sign up for My Humana, your secure online account. Most of your plan information is in one easy-to-access place online. Go to My Humana anytime to get started, learn more about your plan, and see your documents. Your Humana member ID card will arrive in the mail. By providing your email address, you authorize Humana to send you health information at this address. We've covered a lot of information today, but if you have questions, call us. We're your partner in health and always happy to speak with you. Your licensed sales agent who presented your specific Humana plan benefits today can answer any of your questions. Another great resource is the Medicare and You handbook you should have received in the mail. You can also go to medicare.gov. Thank you for your time and interest today.